Welcome to EZDrips, the application for the administration of medication in adult and pediatric critical care. First, we need to make sure that the version of our data is up to date. By pressing on the icon at the top left of our screen, let's choose the version menu. If an update needs to be made, we will be prompted to do so here. In the Preferences menu, we can choose if we practice adult, pediatric medicine, or both. This will change the options on our home page. In the Language menu, we can choose to have the application in French or English. To go back to the home page, we can press on the Home menu, or at any point during the navigation of the application, we can press on the Home icon at the lower left of our screen. The main strength of EZDrips is to help with weight-based medications, and so the next step will be to type in a weight for our patient. For pediatric patients, we have 4 options to obtain a weight. The first option is to type in a weight directly if we have this information. The other options are to have the application give us an approximate weight by typing in patient height, patient age, or by using the Broslow tape. For adult patients, we do need to type in a weight. Next, the application will ask us for gender and height. This is important as some medications are based on ideal body weight or other types of weights, and the application will calculate this for us. You can choose to enter only total weight, but be aware that this can lead to too high doses for some medications in the obese patient. To find our medications, we have a few options. We can either scroll on the main page in alphabetical order, we can type in the drug name in the search bar, or by pressing on the icon on the top right of our screen, we can choose a category and find our medication this way. Different medications offer different options depending on the desired indications, and you will learn to use them as you go along. Some medication pages are very simple and the recipe is a fixed rate. Others are a bit more complex. Let's take, for example, norepinephrine. First, we need to choose if we want to dose the medication in micrograms per kilograms per minute or micrograms per minute. Next, we can choose between 4, 8, and 16 milligrams of the medication in 250 milliliters of D5. To obtain a rate, we can scroll the bar at the lower part of the screen, or by pressing on the rate in micrograms per kilograms per minute in blue, we can directly type in a different rate, and this will give us a rate in milliliters per hour in green, and we can type this information directly in our pump. And this is the main strength of the application. For additional information, you can press on the administration icon. This will give you information about the mixing, initial dosing, and titration of the medication. Some pharmacology and nursing information will be found in the particularities menu. And finally, if you press on the references icon, you can find most of the references that we've used to come up with the information. At any time, you can find what weight is being used for the specific medication by looking at the bar at the lower part of your screen. By pressing on this bar, you can change the information that you've typed in for the patient. Finally, by pressing on the icon at the lower right of the screen, you can find information about weights of your patient, including ideal body weight, which can help for mechanical ventilation, for example. To choose another medication, if you want to keep the same patient information, you can press on the arrow at the top left of your screen, and you can always go back to your home page by pressing on the Home icon at the lower left of the screen. Some medications have red alerts. There are several situations that can lead to red alerts, and these are boxes that will pop up when you open a medication page. The reasons for these alerts can be that we need to consult specific information in menus, that the maximum dosage is reached according to the patient's weight, or that we need to type in additional information, especially for weights. EZDrips is a dynamic application, and over time we will be adding functions, drugs, and information. We will notify by email when there are major changes, but be sure to make your version data updates, and if necessary, visit our website at www.ezedrips.com. www.ezdrips.com for more information or to know exactly what has been modified recently. Don't hesitate to contact us if you have any questions or comments.